Welcome to another edition of Johnston County's online CME program. Today we're going to talk about opioid overdose and the use of Narcan for law enforcement and first responders. This will count as an in-service for our EMT fire department. So let's go ahead and get started, jump into it. The goal of this presentation is to help inform the public safety community of North Carolina on how to recognize and treat suspected opioid overdoses. We'll talk about the background of naloxone, also called Narcan, this program in public safety. Understand the Good Samaritan Law, identify characteristics of an opioid overdose, and learn how to assist in the treatment of suspected opioid overdose. So let's talk about the background. Prescription opioid pain medications account for the majority of overdose deaths. As you can see by the black line starting in 1999, it wasn't the most prevalent. The most prevalent then was, of course, heroin. But as the years progressed, there was a big spike around 2008, and it kind of plateaued from there and went down slightly in 2013. But when you're looking at the time between 2003 to 2008, within 5 years, there was a growing epidemic of opioid overdoses. Also included in this data was methadone and heroin, which spiked around the 2004-2005 era. Most of these deaths were unintentional. Only 17% of these deaths were suicide attempts in 2010. So some of these folks are taking medications, either too much of pain medication accidentally, or they're just combining it with other medications, or they've got some other kind of issue with the respiratory, like COPD or something like that, and they're having that respiratory depression effects because of the interactions of the drug. North Carolina has a higher mortality rate for overdose than the U.S. national average, so it is very prevalent in the state of North Carolina. What is naloxone? Naloxone is a non-addictive prescription medication that helps to block the effects of opioids in the body. It's been used in EMS for over 40 years. It's something that's been used for a very long time and is very effective whenever it is administered. Works within 1 to 3 minutes. There are no effects if an opioid has not been used. This is a very safe medication. There's not really a lot of bad things that come from giving Narcan. You're not going to see any adverse side effects like you would with other medications that could cause nausea, vomiting, headache, diarrhea, kind of the broad effect of some of the adverse reactions that you could have with other medications. So, why do responders carry Narcan? Law enforcement officers and fire departments are typically the first to arrive on scene, especially when you're talking about the rural areas in Johnston County. Most of the time, you get dispatched to an overdose, of course, EMS, fire, and law enforcement is being dispatched. Law enforcement will be there to secure the scene if it's deemed unsafe, and the fire department typically follows behind. Depending on the location and depending on where the ambulance is coming from, it could be a few minutes behind. So, with law enforcement and fire department on scene, they would have this medication and they'd be able to administer it to save somebody's life if they are suffering from a narcotic overdose. There's often that feeling of helplessness while waiting for EMS arrival. You're down there, you're assisting ventilations, you're getting vital signs, and you see this person absolutely unconscious and barely breathing, and you keep looking around thinking, where's the ambulance? It assists in preventing opioid overdose death. If somebody has overdosed on an opioid, of course, their respiratory system is going to be very effective. They're going to be barely breathing, sometimes 6 times a minute, agonal respirations, or not breathing at all. And of course, the respiratory arrest is what's causing the cardiac arrest. So, carrying this medication will be able to assist in narcotic overdoses, especially for the EMT fire department. So SB 20 911 Good Samaritan Naloxone Access Law. The purpose of this law is to prevent the fear of prosecution from preventing someone from calling 911 for the victim. Witnesses to overdoses cannot be prosecuted for possession of small amount of drug paraphernalia or underage drinking. They've called for help. They need help. They've called for help, and they're going to get the help that they need. Civil liabilities for doctors who prescribe naloxone have been removed so that family, friends, and public safety can carry and administer this antidote. Liability for those who administer naloxone has also been removed. This became effective April 9th, 2013. Responding to the scene, giving this medication being accessible to many different people, it has been noticed that it was a growing epidemic. So they created this law to be able to administer this drug to save people's lives and for them to not worry about any detrimental action that could be taken out on them because they've called for help because they know that they've either got a friend in danger or somebody could possibly die because of the opioid overdose. So we're talking about opioids. Well, what are the common opiates? Of course, we know heroin, but you've got other ones that are prescription medications: morphine, Darvocet, fentanyl, Dilaudid, methadone, hydrocodone, Vicodin, oxycodone, oxycontin, Tylenol 3, Percocet, Percodan. This is a very long list of other potential opioids that you could come in contact with. I would suggest that you study this right here. You write them down, you know them, because you never know what you're going to come on scene and find. And also, do a search on the internet and figure out what are some other names of other opiates as well. Be familiar with them, especially if you feel like in your area you have a more common dispatch or a greater number of dispatches to overdoses, especially if it's an opiate overdose. Be very familiar with different medications so you can pick them out very quickly and identify the potential for an opioid overdose when you're dispatched to an unconscious person or whatever other type of dispatch you could be sent to. Signs of overdose. They can be blue or pale skin, of course, cyanotic for not getting the oxygen. Limp body, very lethargic. Slow pulse or absent pulse. They could be vomiting. Very slow, irregular, or absent breathing. You can have the agonal respirations, breathing 6 times a minute. Choking, gurgling, or snoring sounds. Ineffective breathing whatsoever. And of course, loss of consciousness. They could be unconscious but still have effective breathing. So the question is, what happens in an overdose? Well, opioid overdose basically is projected by this picture you have here. The round balls are depicted to be opioids. The brain has many, many receptors for opioids, as you see the jagged looking things at the bottom. Opioids, the round cylinders, will bind to these opioid receptors of the brain. Once it binds to those receptors of the brain, it starts taking its effect. And of course, the effect of the opioid not only is a relief of whatever pain they could be having, but also respiratory depression. So their respiratory rate, which is your normal 12 to 20 breaths a minute, could decrease as low as 6 to 8 or none at all. So we need to administer Narcan on these patients that have had a suspected opioid overdose. Well, the question is, how exactly does Narcan work? It pretty much reverses the overdose. The Narcan has a stronger affinity to the opioid receptors. So basically, it's like you've got two magnets. You've got your opioid, your small circles, which is a weaker magnet, and you've got your Narcan, the brain looking things here, is a stronger magnet. So it's going to attach to that opioid receptor quicker and stronger than the other one is, the smaller magnet being depicted as the opioid sphere. So it's going to bind to the opioid receptors of the brain, blocking the effects of whatever opioid that was taken. So the question is, when do we use it? Well, of course, if we've got a suspected overdose patient, that's when we're going to use it. So following this flow chart here, you've got a suspected overdose. Unresponsive to sternal rub. You're trying to stimulate them. You're going through your AVPU, the alert, verbal, painful. This is where you're going with the painful. Sternal rub, no response. You're going to check their breathing status. If they're breathing normal or they're breathing fast, they don't need Narcan, even if they're unconscious. The goal of giving Narcan is to effectively maintain their airway. If they're breathing normally, they're oxygenating and they're perfusing, and they don't need Narcan. Even if they're unconscious, these folks do not need it. The goal of Narcan is to specifically increase their respiratory rate if it is compromised, as you can tell from the next two. If they're slow, breathing less than 10 times a minute, give them Narcan. If they're not breathing at all or gasping, check for a pulse. If there's none present, begin CPR. And if they're got a pulse but they're not breathing whatsoever, or they're just gasping, give them the Narcan. You've got to start the life-saving techniques if they're not breathing at all. Pull out your back valve mask, do some rescue breathing, get them the Narcan, and wait for the effects. So what are the common routes of administration? Well, they have an auto injector, kind of like an EpiPen auto injector. We're not carrying those. What's going to be approved for use is the intranasal medication administration route, as you see on the bottom right. Using the MAD device attached with the lure jet at the bottom, we're going to be administering this medication through their nose, and it's going to go through the vessels in the nose and get into the circulatory system and effectively work. This is the approved method for Johnston County EMS system fire departments that's working at the EMT level, and also for Johnston County EMS EMT basics. And the law enforcement officers that are approved for this will also be using this route as well. So how are we going to assemble it? It comes in your box, as you see in the bottom. It's got your syringe and it's got your vial of medication. The MAD device comes separate. That does not come in the box of medication. Just your syringe and your vial of medication is the only thing that comes in that box. When you open your box, first pull or pry off the yellow cap on both ends. Pop it off on both sides and then go to your medication. Pop off your red tab and insert it into the butt end of the syringe. Put on your MAD device with a twisting motion, as you can see from steps 1, 2, 3, and 4. You'll be able to do it in this order. Assemble the kit. Wipe the nose clear if necessary. If there's any mucus, vomit, anything that could be blocking the administration of the medication. Keep the head tilted backwards slightly with one hand. Insert the atomizer into one nostril and gently but firmly spray half into the nostril. Spray the other half in the other nostril. Because you're putting a fluid in their nose, you don't want to spray it all on one side because it will not be as effective because some will run out. That's why you tilt their head back, spray one on one side, and then the other half on the other. This way you're not spraying no more than 1 ml in each nostril, and you can possibly prevent anything from dripping out and the medication not being as effective. As you can see from the diagram here, you tilt their head back slightly, you insert the syringe, turn it just a little bit so it falls in line with the natural curvature or formation of the nose, and spray 1 ml in the right nostril, and then do the same in the left nostril with the other 1 ml of the medication. Some special considerations. Always, absolutely always Keep scene safety your top priority. We all want to go home, and we've all got families at home we want to go to. Make sure EMS has been activated and keep them updated. If you administer the medication, let them know. If the patient does not have a pulse, immediately you begin CPR along with administration of Narcan for a suspected opioid overdose. Chances are they probably still have a heartbeat, but it's just so weak you're not going to feel it. So give them that Narcan right out the gate and then begin CPR. If EMS is there, they'd be able to apply the patient on their cardiac monitor. If the patient is gasping or is not breathing, initiate CPR and rescue breathing is necessary in addition to Narcan administration. Like we've said before, it's very quick. It goes in effect of 1 to 3 minutes and typically lasts between 30 to 90 minutes. So go ahead and getting that medication in quickly will save their life. A repeat dose may be necessary in some cases. There's been some studies out there showing that the first vial of the medication is not effective in some of the overdoses. They're seeing repeat administrations to be able to get the desired effect of the patient breathing again. So be prepared to administer more medication. Give it at least 3 minutes before doing so. Rescue breathing can be done in this time while you're waiting for the effect. If within 3 minutes you do not have the desired effect and they're not breathing, go ahead and administer some more medication, because what you're wanting to do is to get that desired effect of the patient breathing again. As the patient begins to awaken, they are often nauseated, vomiting, and combative due to a rapid withdrawal. These folks are going to be upset you've taken their high away. So be prepared to turn them to their side so they don't choke on their own vomit. And if they become combative, back out of the way and have law enforcement assist you. Always keep the patient's safety in mind as well. There is no effect on the patient if Narcan is given and they have not used opiates. Like we've said before, it's a very safe drug to use. So let's talk about some examples of Narcan kits. As you can see, they come in various different shapes, sizes, and forms. Your Narcan kit should be something like the one on the far right in the Ziploc bag. It basically is going to contain the box of medications, and it's also going to contain the MAD device and a set of gloves. Special thanks to our partners, Project Lazarus Community Care of North Carolina, North Carolina Office of EMS, and North Carolina Harm Reduction Coalition for assisting and putting this presentation together. Here's some sources that we've used that you can go to and read up on more about narcotic overdoses. We're also going to cover the protocol for the use of Narcan. That way you guys will see the Johnston County EMS 2016 protocol for suspected narcotic overdose. This is our protocol for overdose and toxic ingestion. Now this is going to be more than just narcotic overdose. We'll also go over the one for law enforcement officers as well. So your history: ingestion or suspected ingestion of potential toxic substance ingestion, route, quantity, time of ingestion, reason, suicidal, accidental, or criminal, and available medications in the home. Get a good past medical history and medications. Some of your signs and symptoms, of course, we've talked about them. Mental status changes, the blood pressure could be low or high, respiratory rate could be low. They could have a high pulse or in dysrhythmias, seizures, and then your sludge and dumbbells is for other toxic ingestions. Some differentials. This is just different things that could have been taken. Come down here. Scene safe? Yes or no? If not, call for additional help. Definitely get law enforcement there. If it is, adequate respirations, oxygenation, or ventilation. If not, the EMT basic can give Narcan 1 to 2 milligrams intranasally. And then as it goes down, If they're good with their oxygenating, ventilation, respirations are good, it goes down to the further flow chart of getting a blood sugar to determine if it's a possible diabetic emergency. And we scroll down, skip over all the other stuff for the intermediates and paramedics. This is some of the key things you want to keep in mind. Time of ingestion, it's important to know time of ingestion or the time that they took the drug. You want to know exactly what it was and what they were taking. So down here at the bottom, you see the pearls, recommended exam, and also at the bottom, what we're going to focus on, the next to last one, EMT basic and law enforcement officers may administer Narcan by the intranasal route only. So let's go ahead and look at our 27A law enforcement officer Narcan. This one's very simple. History of previous drug use, paraphernalia on scene, known access to narcotics, signs and symptoms, altered mental status, unconscious, decreased breathing, pinpoint pupils, cyanotic lips, pale skin, and track marks. So what's differential? What also could be going on? Other than, of course, narcotic overdose, it could be a traumatic injury or assault, it could be a mixed overdose, it could be alcohol intoxication. Of course, they could be dead as well, without a pulse in cardiac arrest. Of course, activate EMS, patient awake or able to be awakened. If they are, stop, do not give Narcan. If not, is the patient showing signs of life? No, begin CPR, call for additional resources, and apply the AED is available. If the patient is showing signs of life, history or signs and symptoms of an overdose. If they're alert and talking, do not give Narcan. If there is showing the signs and symptoms of a narcotic overdose. Intranasal procedure with Narcan, place the patient in recovery position in case they start vomiting, and monitor condition CPR as needed. And down here it talks about the procedure. Confirm correct medication, expiration date, and dose. Of course, Narcan is carried as 2 mg medication in 2 ml, attached to MAD device, mucosal atomizer device, the nasal atomizer to the syringe. Place the atomizer a half an inch into the patient's nostril. Briskly compress the syringe to administer half of the medication. For adults, remove and repeat into the other nostril until all the medication has been administered. Volumes greater than 1 ml are too large and will lead to failure because the drug cannot be absorbed through the nasal mucosal fast enough. It'll drip out or drip backwards. Monitor the patient for signs of improvement, such as increased respiratory effort, improving level of consciousness, and purposeful movement. As you can see, again, this is what it'll look like when it's together, and this is putting the patient into the recovery position. The pearls here, subject may become combative after Narcan administration. Subjects may vomit after Narcan administration. Move them quickly to the recovery position as seen above. And of course, the nostril can only absorb 1 ml of fluid. Factors that may affect mucosal absorption of the medication may include recent use of vasoconstrictors, nosebleeds, or nasal congestion and or discharge. If you see anything in the nasal passage, try to remove it. So this concludes our session for the Johnston County in-service for the EMT fire departments. If you have any questions, please feel free to contact the EMS Training Division. You can contact me directly in my office at 919-553-5493 and send me an email, brad.baker@johnstonnc.com. Thank you for your time.